Okay. Hopefully everyone got a little snack or something to drink. Yeah, let's do it. Could I ask you to shut the door, Betsy? Okay, great. Well, I think we all can notice that we have some new faces in the room. We're joined by several of our researcher and clinician partners who are attending another conference in the Boston area. And so it's such an incredible opportunity to have these partners here with families today. And so specifically for this session, we would really love to take this opportunity with so many different perspectives represented in the room to really start discussing our research agenda and talking about where are there areas across the research that is being done right now in the HIE space, where there are gaps, and what are our priorities. And when I say our priorities, it's family priorities, caregivers, individuals with HIE, and clinicians and researchers. So all coming together and discussing uh, where are we moving forward? What are the important areas? So our goals today is to begin building this family-centered research agenda across our community. I want to first thank so many faces that are part of our PCORI Project Advisory Committee, our PAC group, that helped bring this session together for today. You'll see many of them represented by the facilitators in the small group discussions. And we are so lucky to have your expertise weighing in on this project. So overall, as I said, our session goals are to talk about where are there important unanswered questions about HIE. And we're going to do this through three different goals. The first one is we're going to start generating a list of research uncertainties across key topics of HIE. And then we're going to work collaboratively and start to think about if these research uncertainties can be refined into research questions, questions that then can be used by researchers to start answering and addressing. And then finally, the last piece is we'll also be talking about, are there comparative research questions? So research questions that look at two different comparators and trying to determine what is most effective for future studies for researchers to do. So a little bit of background information before we jump into the discussion. First, I know we had shared a pre-webinar introducing some of these terms, but as a reminder, I know we've been had a lot of information thrown at us today, so I will just do a little bit of broad defining before we move into our small groups. The first is looking at research uncertainties. So what do we mean by research uncertainty? This is something that we do not know the answer to. And so from all of our different perspectives, we may have different understandings. And for our family representatives, this may be something that across the journey with HIE, you found an area of unknown. And this is what we really want to hear about today. So some of the examples of research uncertainty that we can present here: what percentage of children with HIE develop epilepsy in the later years? Are there early life predictors for who may develop epilepsy or other secondary symptoms? What percentage of children after HIE require one-on-one support at school? Of course, these are only three examples. This list would go on, and that's what we're hoping to collect today, having a better understanding of where are these really important gaps, and then essentially how do we move forward from here. So how do we use research uncertainties? Research uncertainties are the starting point, and from there we can start to build research priorities. So all of this work is coming from a call to action last year at our medical advisory board, and there was a discussion about, so many of our research partnerships are reactive. Researchers come to Hope for HIE, they approach Betsy and say, we really want the community involvement on this really important project that I'm working on. And it's wonderful to have these passionate researchers, many who are sitting in the room, on the topics of interest. However, as an advocacy organization and as a community of so many strong individuals with different perspectives, it's really important that we start moving into a proactive approach, that Hope for HIE has a better understanding of Where are the priorities? What should we be focusing our energy on? And where should we be putting our research partnerships, pushing them in the direction of, so that we can be addressing the most important questions now? So this is on the right, we look at Hope for HIE's research journey. So while of course the journey always starts in being participants, part of the community, acting in clinical trials and getting more knowledge there, but then you can move into partnership, in engaging on these projects and starting to consult and advise. And hopefully the next direction that we're moving in now is driving priorities. Once we have a better understanding of where the community priorities exist, then we can drive the research questions to answer those. So Betsy shared this slide earlier. This is our HIE research agenda. And so ultimately, after the medical advisory board last year, Betsy and team had then said, okay, this needs to be a priority. So we started off down the road and we began generating ideas, gathering insights from families, clinicians, researchers. In the earlier sessions talking about outcomes, you heard when we started the conversation at our leadership summit in October, and we started to identify what are some of these emerging priorities. Here we are today, and our goal for today is to start building collaborations. As I mentioned, we have diverse stakeholder groups in this room. So we have the opportunity to form partnerships with families and others in the community, and we can talk about where are our shared goals. From here, we'll continue defining our research priorities, using it to form a formal prioritization framework. So we'll look at the research uncertainties and research questions and start to determine where the priorities are and reach agreement on that. Finally, all of this work will formalize an HIE research agenda. This will be a structured, family-centered research agenda that can help guide future research and ensure alignment with our family priorities. We want to mention that we're using many different examples of this across the space of different disease spaces and others who have done work like this. One of the popular approaches is through the James Lind Alliance Priority Setting Partnership. And James Lind Alliance is JLA, and it provides a step-by-step instructions for doing this kind of work, for establishing research priorities. And so we're utilizing a modified JLA framework to identify, refine, and prioritize unanswered research questions. As you notice, we're all the way up the top. So this is just the starting work of this. I mentioned the PCORI project at the beginning, and that is a 12-month project that is just getting started. And so through that project and through the additional work after, we will make it through these steps to eventually have our formal agenda. The goal is not to complete this today. This is just the early conversations. So in the beginning, I had talked about our session goals. We walked through some of the research uncertainties. Another question that we'll be asking all of you today is start to think about how we can work collaboratively to refine topics into research questions. We recognize that many of the conversations that we'll have today will fall into research uncertainties, which are more broad areas of uncertainties, describing where evidence is missing or inconsistent or unclear. And it's okay that this discussion is unstructured. But ultimately, what we find most actionable is when we can move the conversation into structured approach of developing research questions, which are ready to be tested by researchers. So we recognize that some of these uncertainties might not be at that point yet. However, some of them will be, and we can translate them into specific research questions that could be used in research studies. How do we go about doing that, though, is one of the ways that we suggest is using the PICO framework. So talking about these components that build and make an important way to develop research questions. We're looking at PICO, which stands for Population, Intervention, Comparison, and Outcome. An example of this is that you can look at the research question starting to define a more specific population. So instead of just an HIE broadly, we could start to define, this is a priority across mild HIE. And we can talk about subsets of specifically what population needs to be researched. I stands for intervention. So is there a therapy or is there a clinical service that needs to be more studied? So for example, how does cooling compare? The C is a comparison. So ultimately, what is going to be studied in the research that's being done? And then finally, the O, outcome. Again, this relates to one of the sessions we talked about earlier. Outcome is the measurement or the endpoint used for the study. So what's the most important way that we want to measure success? Yeah, yeah. So the question was, do all research questions need to be a purpose that will benefit? And I think ultimately this is a great conversation for the smaller group, but if you are interested in knowing it, I would define that as a benefit. So I think it's something to think about in the smaller group, but ultimately, again, everyone's perspective is important. And so if you're asking for more information on that topic, that is defining a benefit for you and for your family. So ultimately, what are we asking for you today? We're as part of this process that we're doing, we're gathering input on the gaps of research. So today we want to hear from you on what are research uncertainties, where are questions that you feel remain unanswered, and what are research questions, if you have them, these more specific topics that researchers need to be studying. And it's okay if your input is not perfectly worded. It is valuable to hear your perspective in any way that you're willing to contribute it. Focus on what matters most to you and to you as an individual or as a family, and that's the important perspective that you're bringing here today. The final piece is the comparative research questions. So comparative research questions, or CER as it's called, compares different interventions, strategies or approaches. And this can help us identify what approach works best for a different population. In the morning session with Eric and Danielle, we also talked about several clinical strategies that are being done differently. Maybe that's in different states or in different clinics or hospitals. So this is a good place to bring that up here, because if it's being done differently, it might indicate that there's not enough evidence to indicate treatment A or treatment B or approach A or approach B, and it might be signaling that this is an important area for future research. Again, some examples here that we commonly hear about for comparative effectiveness research for HIE. So for example, what approach leads to better outcomes for mild HIE? What approach leads to better outcomes for preterm? Should anti-seizure medication be discontinued before or after the NICU? What approach for feeding leads to better growth? These are just examples. So you can think in your own experience, in your own practice for any clinicians or researchers, where are these areas of uncertainty, and would they be fit for comparative effectiveness research study? The reason why we also have this is because, as we've mentioned, PCORI, which is an independent nonprofit research organization, funds CER, and they have funded this conference for us. And so part of our goals for today's session is also understanding how we can use these conversations and partnerships that are being developed today to move future funding opportunities forward through PCORI or other research funding agencies. So I'll stop and see if anyone has any question about that overview, but ultimately the goal today will be to move into breakout groups. So we're going to be working in smaller groups around key stages of the HIE journey. And in your smaller groups, you'll be answering these questions, identifying research uncertainties, translating them into research questions, and then thinking about CER. Does anyone have any questions before I move into the way that we've done the breakout groups? None there either. Okay, great. As many of you that have been here for the day have seen this slide, I wanted to again indicate that this is the work that's continued from the Leadership Summit that we convened in October, where we started to discuss what are important research questions, and we had our contributors for that event submit research questions that they felt were really most important for the community to be working on. These are the different areas that were the broad topics from those submitted questions, and these are the areas that have then informed our discussion today. So ultimately, we will be using 6 breakout groups across our group our group today, and then additionally for all of our participants in the Zoom room, you'll be able to participate virtually as well. So total there'll be 7 topics. The first one, we really broke them down to look at kind of across the HIE journey as much as possible, recognizing that there is some overlap over these topics, but our facilitators are ready to try to keep us focused on the topic that was assigned. The first one is causes, risk factors, preventions, and types of HIE. So trying to understand why HIE occurs, how it might be prevented, and whether different forms of HIE affect different outcomes. So these are the earliest point of HIE. These are some suggested topics in this breakout group that the facilitators will walk us through in a little more detail. The second group is diagnosis, prognosis, and predictive measures, and this is our ability to identify HIE quickly and accurately, and then understand what those early findings mean for longer term outcomes. So this will be group 2. Group 3 is monitoring, follow-up, managing seizures and sleep. So this is ultimately what's happening after diagnosis and looking at care, monitoring, treatment, navigation for those early clinical and early development years. Ultimately, most of this discussion will happen around 0 to 3 years, with some examples listed here. Group 4 is our longer term group, so thinking about brain development and daily function, understanding how HIE affects brain development, neurological health, and long-term functioning. And ultimately, this could be like age 3 and older, school age outcomes, adulthood outcomes, things like that. Group 5 is family experience, advocacy, and care systems. So focusing on how families navigate healthcare, education, and service systems, and how these systems can better support families. And then 6 is developing and evaluating new treatments for HIE, advancing research on novel and investigational therapies to improve outcomes for children with HIE. Our virtual group will be talking about specifically CER, comparative effectiveness research questions. We recognize that these can kind of cut across all stages of the HIE journey. So while we will be discussing some CER questions specifically within the breakout groups, our virtual group will also really tackle this in more detail. How the breakout will go is, I don't have my clock right now. I think so. It'll be about a 45-minute breakout, and then we'll come back together and do a report out. So you will get to hear from all the topics at the end. You'll just spend a much more focused time on one topic. Now I'll walk through the assignments. And as I do this, your facilitator will wave so you can, when we move into the breakouts, you can follow them into the location so you know where you're going. If you don't find your name on this list, please just come and find me and I'll get you in the right spot. Okay, for group 1, causes, risk factors, preventions, and types of HIE. Our facilitator is Betsy. So Betsy, you want to give a wave? People can follow you. We'll say group 1 will be up in this corner. Yeah, and she has her sign. So if everyone can find your name on this list, I'll leave it up for a minute. And then when we go to move, you'll be moving into the group 1. Group 2, diagnosis, prognostic, and predictive measures, led by Eric. We'll move group 2 just to the left a little bit, and these are the individuals that are assigned to us. Group three, monitoring, follow-up, managing seizures and sleep. And we have Anna. Let's see, where's oh, right there. Yeah. Okay. We'll move you to the middle, Anna. So that group three will sit in the middle. All right. Group four, long-term brain development and daily functioning. These are breakout assignments, and your facilitator is Danielle. Where'd you just go? Oh, there you are. You're already in place. You're ready to go. Hmm. Group five is, oh, sorry, did I move too fast on four? Did everyone get their name? No. Okay. Group five is family experience, advocacy, and care systems. Allison and Paul, Allison, you have the sign, and Paul's here. You guys will go in the middle back somewhere. Mhm. And then group six with Brian doing treatments. Brian's right here. You can follow him out. We'll be in the community breakout room over there for group six. And then Monica, thank you so much for being willing to lead this. I'll make sure that we move all of our participants in the Zoom room to speaking. So you can all move to your assigned group. If you have any questions, come find me, and then I'll be walking around, but we will be in these groups for 45 minutes before I report out. Yeah, there we go.
Hi, everyone. I think that we are starting to get the technological framework worked out. I just wanted to check in for folks who have joined virtually. Can you hear me okay? And are you able to participate at the moment? Do what works for you and just come off mute or on camera as you see fit.
I
Yes, I
can
can hear
hear
you.
you.
Oh, fabulous. Wonderful. Well, it is a pleasure to meet you all, and It, it is really a pleasure to be part of this conversation. My name is Monica Lemon. I'm a child neurologist who wishes that I were there in person actually with the group, but my family fell ill and as did I. So here I am participating virtually. And I'm excited to do our best to facilitate a conversation via Zoom if we can. I wondered if we might start by just a round of introductions, if that would be okay with folks.
Sure.
Wonderful. Deborah, would you be willing to get us started and share as much or as little as you'd like to? I'd really just love to get to know you all a bit and we can launch into the conversation.
Sure. I'm an open book, except I am not visually ready for prime time today, so I'm going to leave my photo up.
No judgment.
Yeah, I wish I could have been there too. That was kind of the original plan, but just things are really, really busy with work, and it just didn't work out. But anyhow, uh, I'm an HIE parent. I had a little girl, Kirsten. She was born with severe hydrocephalus, and at 14 months had a catastrophic shunt malfunction that left her with a severe HIE injury. I lost her about 3 years ago. But I was a caregiver, and we're all way too familiar with the fact that there just isn't enough support out there, and there's not enough nursing. Um, so I kind of I had to kind of leave my marketing and comms career to manage her care, and basically just like everybody else, ran the subacute facility from home, or the mobile PICU, or whatever we like to call it. So she was severely affected, and trach G tube. I used to joke that I had my mailing address changed to the hospital. She had a really really tough time. I didn't find hope for HIE till she was probably, I don't know, maybe let's say 4 or 5 years old. But yeah, I kind of feel like she was here to put me on a mission, to try to make a difference. So, I'm very committed to helping hope for HIE. And honestly, I think she dropped my current position on me because I had to go back out to work and wasn't exactly feeling very enthusiastic, based upon my age and, typical, age-related difficulties in marketing and comms. And I wound up landing in a position, at the UC Irvine School of Nursing, and I'm the director of communications and marketing there. And I've got a huge place in my heart for nursing because of what I've been through. And they tell me that's like, well, you didn't go to nursing school, but you did the clinicals, and kind of an honorary nurse. And so that's what I'm trying to do, is just she put me here to make a difference, and hopefully make it a not so painful experience for those going forward.
Wow. Thank you for sharing that, Deborah. What a legacy that Kirsten has left in you. And it's really pretty incredible to hear about how you've taken that experience and forwarded it on through your work, both at Hope for HIE, but now in a new position where you're getting to use all of that knowledge to support the program at UC Irvine. So thank you for sharing all of that. Very much appreciate it. Anyone else willing to introduce themselves so we can get to know you a little bit?
Hi, I'm Bill. I'm attending this from England, and I only heard about this kind of in the past week or so, so I'm very glad to have been able to attend. I've got a 5-year-old, Lexi, who had a heart surgery when she was about 2 months old, and had some complications afterwards, and needed ECMO twice, and after that had some type of stroke. Not quite sure exactly what happened, and since then just have been just trying to progress and face all the difficulties which I'm sure other parents have been experiencing, and just trying to find out kind of what can be done elsewhere. I think one of the difficulties with the United Kingdom system is that we have a publicly funded NHS system, which is great in many ways, but at the same time, I do feel it can stifle innovation and treatment modalities, because of the public funding means that everything has to be very much evidence-based and scrutinized and in guidelines before anything can be done. So I think it can limit what can be done. And to me, I kind of feel that I don't really have time to wait for all the evidence to be made available. So I'm hoping that I can hear of other people's experiences and maybe get a glimpse as to kind of what maybe out there in the wider world where other treatments can be done as well.
Well, thank you for that. And I think your background will be a really important fit and perspective for the topic that we've been asked to cover actually in this session, which is about exactly what you described, comparing systems and thinking through how different systems might impact both the care and the innovation around HI research. So I'm excited for your participation and to hear that perspective. And Lisa, are you in a place where you can unmute?
I can. Can you hear me?
Yes, we can hear you well.
All right. My video is, I'm trying to get it to work, but it wasn't cooperating. My name is Lisa. I live in Mississippi in the United States. My HIE kiddo, his name is Peter. Peter is 7 years old. And yeah, I think I've been a part of Hope for HIE for about 6 years. He is in Peter's in first grade. We go to school 3 hours for 3 days per week. I am also a mom to my youngest son, Zachary, who is 5, and he has an ADHD and autism diagnosis. So Peter is completely wheelchair dependent and dependent on me, and Zachary is got a diagnosis where he kind of just runs around the house. If the camera was on, you'd see him peeking at you guys right now, but he's not wearing pants, so it's probably best that it's not on. And I guess my experience is a little bit unique in that I started this journey with my husband, and we were both really integrated and into it together, and he had a pretty good income, and we made we were making do. And then my husband died of cancer in 2022, so now I'm doing it alone. And yeah, life's just a little bit different, so I know what it's like to be more proactive and ahead of stuff. And then I also right now I'm more just kind of scrambling to keep up.
Well, Lisa, thank you for sharing that. What a journey you have had. And I think that, while we are a small group in comparison to some of the ones in person, I think that the depth of the experiences that you all just described are going to be really, really key to incorporate as part of this bigger exercise. So I very much appreciate you taking the time to share that. And I think I got everyone. Is there anyone who I missed that's on this Zoom that we want to make sure to hear from? I see Maggie, but I believe that both Maggie and Jacqueline are helping us facilitate the broader session. So I'll share a little bit about our charge in this group. So we've been asked specifically to think about questions around comparative effectiveness research. And Maggie described that there was also a more detailed description of that earlier in the day if you were able to join. But just as a reminder, this is really a topic and type of research that's meant to directly compare existing interventions, either drugs, procedures, diagnostic tools, models of care, to understand what works best. And it's a way of really trying to compare things happening in the real world, as opposed to thinking about novel therapeutics that aren't in use yet. And so that we've been charged with specifically thinking through what comparative effectiveness research questions or uncertainties might exist across the HIE care continuum and also across settings. So to your point, Bill, how to think about how we might leverage different settings to try to understand important things about how HIE is diagnosed or treated. And so I'd love to kind of set the stage with, we're not trying to solve these problems today. Really, our first goal is to try to think through what are the uncertainties that exist. And so what I might just ask you all to help us brainstorm is, where are some areas where you feel like we don't know enough, or perhaps there isn't enough clarity? And then we can kind of refine that and brainstorm about how to turn that into research questions. And I'll take a step back and ask a few more kind of prompting questions to see if any of those help us get the juices flowing. So it might be things like, what are you or other people in the HIE community needing to make decisions about or think about that really aren't based on enough evidence or enough research? Or are there important questions or important way things are done in different places that we need to compare and that we need to study? A lot of times these questions might start with something like, what is the best way to, if that helps us kind of narrow in.
I'd say, in my opinion, the biggest uncertainty is that every single brain reacts so uniquely, and lighter damage to more severe damage isn't necessarily a predictor of outcome. So there's not a good way to set a baseline. For example, like when my son went in to get a hearing test, they program your hearing aid off of the fifth wavelength. My child's was completely flat, which means that the audiologist doesn't even, she can't even read or tell us how much he can hear, how much he can't. And so much of stuff and growth in that is just, I guess there's just not really stuff to compare stuff to, if that makes sense.
Yeah. I think so. And let me repeat what I think I heard because I want you to correct me if I didn't get it quite right. But I heard a few really important ideas. One is that every brain reacts really differently, and that looking at injury alone isn't enough sometimes to predict outcome. I also heard you mention a really important question or uncertainty about there's not a good way to understand a child's baseline, and kind of a good launch pad for clinicians or other people to start from. Did I get that right?
Yeah, that's kind of what I'm thinking. Because as far as knowing if he's even just his lab work, there is kid, typical kid normal, and then my son is just on his own threshold. So his doctors just compare it to previous hospitalizations and previous visits rather than for him rather than to a group of people. So I feel like each kid is their own normal. And so it's harder to collect a subset of how something is going to work for everybody.
Thank you for adding that extra information. I think I'm hearing something even more nuanced, which is that he's on his own curve, kind of he's on his own trajectory. And it's really hard when there's not a norm to compare something against. And so that's a need. Thank you.
I agree. I think their injuries are just like a fingerprint. They're so individualized that it's really hard. Um, my daughter had all kinds of problems. She had a very severe CVI. She was trach. She lost her ability to manage her secretions. Um, she couldn't speak, and she had some delays because of the hydrocephalus before the HIE event, but she was still learning to talk. She could see, she could move volitionally, and then basically lost all of it with the event. And I guess one of the things that was really bothered me was there was no way other than my gut mommy intuition to measure her ability to her cognition, and I'm pretty sure she was in there, because there were times where um, she was funny, and she would make appropriate faces at the appropriate times, even, and you could tell she was kind of a little nosy busybody, because we might have two of her nurses over, in the other corner of the room, you know being a little gossipy, and she could tell she was kind of cocking her head that way and kind of moving her eyes that way, like she was trying to like eavesdrop and listen in. And I just wish there was a way we could measure what's going on in there. I mean, and I know they can do like a little bit of like functional MRI. That was something that we never had access to, but yeah, I just think they're just so individual, and they're hard to measure, especially when the injury is that severe. Because, as much as I wanted to get her like an AAC device, when she doesn't have very, very little volitional movement and she can't see and she can't speak, it's like, what are you supposed to do?
I think this is such an important point and is absolutely an uncertainty. And so just to restate it so that you can tell me what I've missed as I'm recording things. What I'm hearing you say is every child's individualized, and our measures, our ways of understanding how children are doing just aren't up to the task of measuring what our kids can do, especially when certain domains of development might be severely impacted. Is that a fair summary?
Yes. And I think when you've got somebody that is compromised as she was, there's just this assumption of um they I'm blanking out on the word. Sorry, brain fart. Um Competency. There it is. They just kind of assume there's no competency. And really didn't understand how profound that was until I pulled her out of school the day before lockdown, because I just had a gut feeling that, something was going to be really bad about this pandemic. And I pulled her out. And so I started having to do the homeschool thing with her. And she was the equivalent, I think, let's see, 2020, 13. So probably about middle school, early high school level stuff. But then when we were doing the online stuff, what they were teaching her in the classroom, I was horrified by. They were still doing days of the week and preschool sing songs. And I'm thinking, oh my God, you're making an assumption that she's got nothing going on in there and she's a preschool level. And, you're boring these kids to death, with this kind of thing. And I basically took over and became my own teacher and started looking for science things online and trying to do as much as I could with her. If her hearing was intact, it was as far as we know. So she had that going for her. And it's just, I think we need to find a way to measure what's going on. Even though these kids are so hard to measure, so we don't assume that there's no competency.
Yeah. Incredibly astute and wise perspective. What do others think? Either building off of that or offering up something different.
Something else that makes stuff hard is that with a lot of our children, their abilities are variable day to day. So for us, if he's going to get evaluated and it's a performance, he has to, like, if it's an appointment, he has to perform for, like, for example, a visual appointment where you have to see things in certain areas and react. Sometimes he'll score really low, just because he's not as performative that day. And so when you change different, like developmentally, hearing wise, vision wise, day to day, or even hours throughout the day, it can be harder to collect accurate data on the kid.
That variability, I think, is what I'm hearing in that, not just day to day, but hour to hour. And that seems to me that probably relates to some of what we just heard from Deborah
I
about.
agree. I absolutely agree with her. They may be having a good minute, a good hour, a good day, or maybe not.
And so I'm hearing at least one common theme about how do we accurately capture information about potential or about strengths and function. Um, how do we capture that variability? How do we capture cognitive ability, especially when other domains might be severely impacted? I think that's the theme I'm hearing so far. I'm going to ask us to think a little bit about taking some of those ideas and diving into them a little bit more, especially as we think about our topic area, which is about sort of comparing existing strategies. Can we maybe brainstorm a little bit about how we might kind of narrow in on some of these ideas that we've been talking about as they apply to comparing things, either across time or across settings or across measures?
Comparing is just so hard when there's so many variables. I feel like that's why we're all so quiet. So it might just being cognizant of where you're collecting your data points from. And maybe you collect around the same time on 4 or 5 different days. Or there's some sort of evaluative measure as to how if the kid is, this is going to be a terrible word, but if he's I guess if his cognition or if he's more with it today than other days. And so it's going to be figuring out how to account for variability. So I guess the idea I would have would be just to collect more data points, but that's hard because anytime um, evaluations and stuff like that are so limited.
I have zero idea if the data is out there, but is there anybody who's doing things like the functional MRI with some kids and comparing them with similar tests and who aren't getting the functional MRI? Are there differences and assumptions that are made by professionals and parents or whatever between the two groups?
I love where you're headed with that, and I think that both of you actually started to narrow in, I think, on what on how we might start to tackle this. I'll just sort of echo you, Lisa. I think this is really hard, especially in this space where we might not have as much information. But to your point, Deborah, I think that one way to think about comparison is exactly what you shared, which is how do different diagnostic strategies, perhaps imaging or measures, capture cognition, or variability, day-to-day variability, or strengths. Those are things that maybe a place to start.
And kind of the reason I suggested functional MRI is they're reading what's going on, real time with their brain without them potentially not you could read somebody like Kirsten, she can't see, she's got, very, very limited volitional movement. She can't speak. How else do you measure other than let's see what's firing up when we're interacting with her while we're imaging?
Yeah, that's right. And there's something about that that sounds dynamic as opposed to static, if I am hearing you correctly. That sort of strategies that are more dynamic that allow for more interactivity could maybe get at that more easily.
Yeah.
Lindsay, hi, welcome. I see you here. We're so happy to have you. We did a round of introductions earlier, but I'd love to just take a moment and hear from you if you'd be willing to just introduce yourself, and we can sort of catch you up to where we are at the moment.
Okay, sure. Thank you. I actually just cut out for about 2 or 3 minutes.
Okay.
Yeah. And I did put a question in the chat, so I'll like re-ask that question. If my question made it in there before I cut out on my technology, I lost power on my one device, so I switched. But my name's Lindsay. I'm really new to all of like this information and in the capacity that it's being shared and delivered under a hope for HIE. I just kind of came across this just a few weeks ago, and I'm like excited about that because I was able to then tap into this conference. But interesting, my son is actually 10. So at the time, I had an understanding a little bit of, what he experienced at birth. His neurological report said mild residual encephalopathy. I don't think I really knew what that meant at the time, or the potential significance of that. When he was 3, he started to have seizures. And so 2 pediatric neurologists both said they are not related. His epilepsy now and his experience at birth are not related because the MRI is normal. And so for years, I kind of just went on with that with hope. It was interesting to hear, I think it's Stephen Laser that spoke a little bit earlier. My child falls short on so many of those developmental, behavioral, emotional, social topics, that were discussed. He has quite a few delays, occupational speech, but he got off the seizure medication and hoped that he would be stable, but the seizures started again in the fall. So I kind of, my hope and kind of put my blinders on and moving forward, that his case would be mild. And maybe it still is relative, to what it could be. But this year it just seemed as though, not that he fell backwards, but just that his progress, wasn't moving as far along as his peers. That gap grew bigger with his peers. And again, his seizures increased a lot. So I'm kind of back into getting more information, as much information as I can. And that's why I came across the group. And just, I think you're maybe listening for areas that were, cumbersome for us or troublesome for us that maybe could get attention. And I do have some frustration with, that statement that 100%, the second neurologist said 100% the epilepsy is not related to the experience at birth, the HII at birth. And I'm not medical at all, but I do have frustration with that because until we understand 100% of all epilepsy sources and causes, I think it is not fair to 100% rule out a potential cause of a single epilepsy case. And it sounds like might be similar to some others in this community. So maybe my suggestion or my input is maybe further understand the limitations to the MRI and what maybe could be lying underneath that doesn't show up as a structural damage, for instance. Maybe it's at a lower cellular level that might be having an impact to epilepsy. And that's all I wanted to mention, but thank you for the time.
Oh, Lindsay, thank you. I think that's such an important point. And I can imagine, there's so many research uncertainties within the story you just shared, and even within that question, that I think we can kind of build off of. And one of them is, what are the limitations of MRI? Another might be what's the most accurate strategy for detecting the risk for epilepsy later in life. And so I appreciate that very much. And so we'll make sure to capture that in the group. Welcome.
Thank you.
And anyone else who's joined that we didn't get a chance to hear from yet, I think I see everybody here. And so now kind of returning to thinking through the research uncertainties maybe that we've identified. And we can take a moment to kind of drill down on those. I think we've identified predicted limitations in prediction, like Lindsay just shared, limitations in ability to see strengths and especially cognitive strengths in children, especially those who are severely impacted, an inability of our measures to capture the variability day to day, hour to hour, individual to individual those are some of the ones we heard of. And so now I'd love for us to just kind of try to drill down and think about how we might turn some of those into questions, into research questions. And as I mentioned before, our charge is to think about sort of comparing strategies, but I'm going to go off book a little bit and say that let's come up with research questions first. And if some of those we can think of ways to fit it into the comparative effectiveness framework, that's wonderful. But I think our priority is to make sure we capture your thoughts and think about them with research questions. And so perhaps we could start with, if you're open to it, this uncertainty about cognition, about kind of measuring and understanding cognition. Um, Deborah, this was one of your important points. As we think more about that, what are some questions you have that you wish researchers would focus on as they try to address that uncertainty?
I would want to find a way where a way of measuring that is more reliable than what we have now, which I honestly think is pretty unreliable. I don't think we're ever going to find anything that's perfect, but I think we need to find a way to measure and not make assumptions.
Yep. And so that sounds like, what's the best way, right, to measure cognition and the ability of a child to interact with their environment? That's what I hear. I also hear this question about assumptions, which is what's the best way to tackle assumptions, inaccurate assumptions about function or cognition?
I mean, just the first thing that comes to my mind is the functional MRI, because they can look at the different parts of the brain light up as you interact. I'm not really aware of other diagnostic methods, although maybe there are.
And so, in thinking about how to turn that into kind of a comparison question, how do different strategies, for example, MRI versus maybe an assessment that someone did in the clinic, um, assess cognition? Is that a
Yeah,
fair?
that's actually interesting. Like maybe putting the same child through two different assessments and
Mhm.
doing that with a group of children and seeing if we see any patterns come out. So
And as you
instead of like one group of child or one group of children all getting functional MRI versus another, like a clinical assessment, each child would get multiple assessments and see what happened in terms of an entire population. When you look at that, are there any patterns?
So I hear you already thinking about study design, which is that kind of comparing two things, but also making it longitudinal might be really important to capture some
Right, yeah.
day-to-day variability.
I would add comparing EEG during like assessments versus clinical assessment, because EEG measures the brain waves. I know there's a company called Think to Switch that's utilizing an at-home EEG device and actually trying to use that into AAC communication, to where they're trying to translate brain waves into what is being communicated on the tablet. And so it's I'm trying to think of how to word that in a comparative question, but I guess EEG activity versus clinical observations.
I think that sounds like you've done it perfectly. One thing I'll ask both of you is, we often, we use this PICO framework, which is what's the population, what's the intervention, what's the comparison, and what's the outcome. And one thing I'd love to get your perspective on is, for both of those questions, what might the outcome be? Is it communication ability or parent perception of cognition? Tell me a little bit about what you imagine sort of the gold standard of the outcome might be for those questions.
I would think when I talked about like comparing the two assessments, I would take the EEG, make that assessment number 3, and give all kids that assessment. And for the outcome, I would like to find a way to enable these kids who can't communicate to communicate.
Yeah. And I think I'm hearing, Lindsay, keep me honest here, but I think what I'm hearing you say is a very similar question with an outcome around not just cognition, but what's the communication potential? Is that did I hear you correctly when you were discussing your question?
Yes, I think when I hear Deborah speak a bit, it seems as though, and I want to understand a bit. I understand that the medical teams need to follow, I guess, the current protocol and information that is, understood, and but um, delivering the message that, this is the, be all standard, and this is the information, and this is where your child is at on this category or this test, as so fine, like with such finality, if that's the correct word, is challenging and frustrating, because there's still a lot to be uncovered and understood.
Thank you for that. And go ahead, Deborah.
I think you could put this type of research in a position to challenge the current models to do exactly that.
Yeah, say more about that. I think you're right, but share a little more about that so I can make sure I capture it.
Well, I mean, like Lindsay said, there's models out there where doctors will say, well, this model says this, and this is the answer, and this is the outcome, and it's the end all be all. And quite honestly, I'm shocked that anybody would say 100% sure that seizures weren't caused by the HIE event. But I think we should use new knowledge like that to challenge existing models, because maybe the models aren't right, or maybe they can be improved.
Yeah. And it sounds as though some of the ways in which we've identified they might be improved are by making sure that we're measuring cognition well, measuring full potential, and and finding novel ways to identify what kids can do.
Right, because if we can prove that they've got something going on, we can get them access to more interventions, because some of them are just completely written off because, well, no, your kid will never be able to do that, so you don't get that.
Absolutely. And that feels very much like one of the whys. There are many whys, but one of them is so that we can make sure kids have access to supports that will help them, and so that we can challenge some of those assumptions. And so I'm going to list off the research questions that I've heard, and I want you to add to this before we report out. So I've heard, what is the best way to measure cognition and the ability to interact with the environment? How do different strategies, for example, neuroimaging, assessments, compare in measuring cognitive ability? What assessments or strategies best capture the day-to-day variability or week-to-week variability in developmental strengths? And what is the best way to predict later life outcomes, including things like epilepsy in mild neonatal HAE? What did I miss?
I think you just made us sound a whole lot smarter.
I if I may call you Monica,
Please.
Yeah, in my instance, I think the assumption is that the MRI was taken at the time of the birth.
Can you hear me?
And it was an ultrasound that they did. The MRI was taken when he started to
Monica, I
have
wanted to
his
see if you could hear us
and
in
so
the
it was,
room.
backwards looking. So just wanted to.
Thank you, Lindsay, for correcting me. That's really helpful.
But the predictive part of it is an accurate, an additional.
Is accurate, but the timing.
Okay.
Thank you, Lindsay.
Okay, thank you.
All right, I think they might be ready for us. So I'll pause here.
Monica, can you hear us in the room now?
Now we can, yes, thank you.
Yeah. could you plug in the audio? Yeah. Okay. Sorry, Monica, you want to come off mute and just confirm?
Yes, I can hear you well. Hi, everyone.
Okay, wonderful. We're waiting for all the breakout groups to come back into the room. But I just want to make sure we had our connection reestablished. So thank you.
Thank you.
Whoop, here we go. All right, group one. We were small but mighty. And we had causes, risk factors, prevention, and types of HIE. So we talked a lot about maternal health and what factors might go into identifying risk factors that can lead to prevention or decreasing HIE, including genomics, environmental impacts, better monitoring both during pregnancy and delivery. And then also talking about the different types of HIE, obviously differentiating the needs and the causes of neonatal HIE versus pediatric acquired. And again, the same strategy of where, the causations are that we know and what could be an intervention and prevention point. That's the summary. Is that good? Okay, great.
Maybe we'll see if anyone has any questions or thoughts or anything they want to chime in on.
Yeah, anything we missed because we
Yeah.
were getting our own stuff, conversating, but
Any thoughts in the room or online?
great.
Okay.
All right, so we were talking about diagnosis, prognosis, and predictive measures. And so we a lot of wide range of things. So starting off with actually something that kind of overlaps with Betsy's group and kind of the determination of the timing of injury, and especially those that don't have a clear sentinel event. How do we know when they occurred? And especially in light of that 6 hour therapeutic window that we have for hypothermia. Others are kind of looking at those babies that might be missed early on, so the best indicators of when to obtain the early blood gas or other biomarkers, especially when that cord gas is negative or normal. When the one we ended up kind of pulling out for the research question was, what is the best time to give the potential HIE diagnosis to families? And optimizing that, and how can we do that, especially to look and see if it improves post-discharge follow-up and the services received for those babies, especially if they're getting that earlier diagnosis and families have more time to process before discharge. And then on the flip side, what tools and education do providers need in order to actually determine that potential HIE diagnosis to be able to give it early to families? We talked a little bit about low resource settings and specifically what detection markers can be used or adopted in those settings to improve detection of HIE. And one that I honestly never would have even thought of, which is really fantastic, of how can HIE education be included in prenatal education, like baby books, to better prepare families for difficult outcomes. So not necessarily HIE, but how can we support mothers before they deliver to be ready for the possibility of having this kind of outcome. And then getting into prediction, blood panels are non-invasive markers that would best predict outcomes. And then specifically in those who have early seizures, how can you predict which will have seizures later on and of which kind? And then the best way to determine which early interventions will be most beneficial for a child. So focusing not necessarily as much on the 2-year outcomes, but on the do I need speech therapy in 3 weeks or not kind of questions.
Any comments? Anyone have any questions or things that potentially they want to add into that list? Okay. Group 3.
Thank you. We were also small but mighty. So we were doing monitoring, follow-up, managing seizures, and sleep. We talked a lot about seizures in a couple different ways. First, a little bit piggybacking off some of the stuff that Eric said about, from the NICU, like how you can determine which kids are at risk, but also what the actual impact of the seizures are on brain development, both in early life, but also later on, and how they could be affecting development. The opposite side of that is also understanding how the medications themselves are impacting, and when you sort of can change when something you're seeing in your child is the seizures, or whether or not it's a side effect of the medication that you are on, and how you kind of have. We talk a lot, I think, in the research side about biomarkers by like EEG and like having seizures, but what's the biomarker for whether or not a therapy is effective or not? There's also a lot of questions, I think, about, we talked about sleep a fair amount, and everyone at our table had discussed how sleep was irregular, but how it was very poorly assessed at clinical visits, and particularly poorly assessed the impact both on the child, but probably as the family as well, on their capacity to be able to engage in therapies and do other things with their child, or just function themselves, probably, I would guess too. But try to, if there's opportunities from a research perspective on how we more consistently at least understand what's going on with sleep before we even get to the idea of how we're going to actually impact it. And then also, I think coordination of care. I think there's a lot of questions about, even in widely resourced areas, there might be a lot of different providers, but how those people are coordinated is kind of can be very opaque. And whether or not they're coordinated with each other, and then also how to figure out how to engage which therapies might be most appropriate at any given moment in time. There's a lot of self-advocacy to try to figure that out, as opposed to it being kind of clearly communicated what might be beneficial or not. So particularly in communication strategies from clinicians towards families, how that could be improved.
Thank you. Any additional comments for that topic? No. Okay. Group 4.
Already hearing so many good things. Oh my gosh. Good stuff. All right. Our group was, our goal was to tackle long-term brain development and daily functioning. And we had a robust conversation. We probably focused on only like a quarter of our topic, but we did it in depth. We talked a lot about sensory processing. We talked a lot about meltdowns, behavior, sensory regulation, going from 0 to 100, transitions, asking, is there an increased likelihood of sensory processing disorder in kids with HIE? And if so, what are the solutions that are most effective? We talked about emotional regulation. We talked for interventions about whether there are certain medications that might be helpful, CBT or other therapy approaches, and even just awareness that this is a cause of that response, whether that could be helpful as an intervention. We talked about diversity in behaviors and whether there may be sex differences or other differences that in how those emotional responses come out, internalizing behaviors versus expressive kind of behaviors, clamping up and self-esteem. For PICO, we talked about broadly within our population, broadly across HIE and specifically in adolescents, whether those meds or therapies could lead to improvements in tolerating triggering situations or decreased frequency of meltdowns. We talked about needing to first define exactly what kind of sensory processing problems exist and whether that's different in kids with mild HIE versus moderate or severe. We talked about the difficulty of doing this in kids that are or adults who are nonverbal, and thinking about different outcome scales of how to measure that, talking about seeing a face that looks terrified being different than someone measuring how they express it. We talked about the importance of experiences and how changing experiences on a daily basis could improve or change things. And I'll kind of skip ahead through some of the other pieces, but we talked a lot also about supports and specifically supports in school. How can access to necessary services impact the health and well-being of the family? Parental struggle for milder outcomes. We talked about another intervention, training programs for parents. We talked a lot about perseverance and a pill that contains resilience. If that could be an intervention. For adults with HIE, asking these adults what supports could have helped you, what supports did help you, and also as a comparison group, intervention versus comparison group, thinking about the therapy hours logged versus the parental investment in the therapy, all the extras of what families are doing at home that's not the hours with the therapist, how to measure those pieces, and potentially as an outcome measure there, thinking about participation. So a lot of pieces of our PICO, and we'll have to work really hard to turn it into specific PICOs. Yeah.
Yeah, I didn't know where you're going. Okay, wonderful. Anyone want to chime in? Anything? Okay, we'll move to group 5.
Oh, who wants to follow that? I just said that also. That was sheet number 6.
Yeah.
Not cool.
All right. So we had family experience, advocacy, and care systems. So we felt like this was a very broad topic to cover once we got talking. So, and honestly, as we were talking too, that a lot of this also depends on where you live, what access you're to. So we first off by acknowledging the fact that this is very much a circumstantial topic, but across the board, our main thing we came with was a lot of it was based around education and education for families, education for providers, providers admitting that sometimes they just don't know. Sometimes you can't just say things are the worst possible outcome, and sometimes you have to admit that we don't know. It could be this, it could be anywhere from mild to no outcomes all the way through death and disability, which we now don't clump together after this meeting. That was, what am I missing, Paul? I know I'm missing stuff. The intervention was, we only got little pieces of our PICO because, like we said, I don't know how you guys got through so much over there. We were very much going back and forth on this, but is there some sort of educational, like you guys said, brochure that needs to be provided to families? We talked about like learning the hierarchies of the hospital. Who do you go to if you have a question in the NICU? realizing this probably not your nurse that's at your bedside. It needs to go above them. Do you know that? Helping, providing those advocacy skills to families of, here, you're in the NICU now. If you have a question and your nurse doesn't know, this is who you go to next. If you have an issue, this is who you go to. And then being able to have those tough conversations with the providers, but everybody also trying to keep an open mind is kind of where we came with that. Because obviously, as families, it's a very emotionally charged situation. But being able to have those open discussions and being able to say, yeah, sometimes we know, sometimes we don't. Not saying that you're going home on hospice and then never saying that you're in the clear. We talked about that as well. And for the outcome piece, it would really help just the whole family experience, help prevent secondary traumas, help it relieve anxieties, help with attachment and bonding. There's a lot that went into it.
Talked about
Yeah.
Wonderful. Anyone want to add anything to that group? Otherwise, we'll move to our final group in the room before our virtual room.
All right, so our group was on developing new treatments. And I think first we had a lot of discussion about sort of broad sort of treatment related themes. So who qualifies for what therapies, trying to move beyond sort of subjective criteria to more objective criteria. Could AI be used here for sort of risk and sort of subtype identification of who might qualify for therapies? Kind of defining neonatal encephalopathy versus HIE and how those might qualify for different therapies. We talked about, even controversies around who should get cooled, what is the optimal window of therapy. Families have limited bandwidth, what therapies to spend time or money on. And then we commented on that, there may not be a single silver bullet therapy, and should we consider, bundles or cocktails of therapies. Moving on, then I think we had a lot of discussion around potential comparative effectiveness research for, PT, OT related therapies, things like dynamic movement therapy or other intensive therapies. What is the level of research to support it, and can we compare that to sort of more standard off-the-shelf physical therapy? Opportunities to use technology to augment physical therapy. Questions about the effectiveness and safety of cold laser therapy. So those sort of all fall into the potential CDR questions there. We had some discussion about stem cells. Are they safe? Type of cells? Does it work? Intranasal breast milk was sort of in there about the stem cell discussion. Can we be routinely saving the umbilical cord for babies who might be at risk to provide opportunities for future therapies? Questions around prenatal therapy for neuroprotection for mothers who are showing signs of the baby having distress. And then conversely, since we're mainly focused on kind of acute neuroprotection around the time of birth, can we also think about opportunities in the weeks to months afterwards to sort of promote plasticity and resilience? Another sort of different phase there was for mothers during pregnancy who are showing signs of sort of evolving concerns for fetal health or fetal distress. Can we have interventions that might support placental health to sort of prevent HIE? One question was around, understanding the children and adults who have sort of outperformed expectations and kind of distilling down sort of resilience signals and sort of what has worked for individuals to sort of help guide families on their journey. Closing the gap between animal studies and human biology so that we can really understand what's happening in human babies to better identify new targets. Using parent-reported outcomes for new therapy development, not just our traditional academic outcome measures. So those were some of our themes.
Okay, well, this is a long list and it's growing more. Let's check in with our virtual group as well. Monica, if you can come off mute.
Yeah, hi everyone. I am so sad not to be there with you all in person. We had a really wonderful conversation, and also we're a small but mighty group. Some of the topics that we really focused in on that were of interest to the virtual participants were around the challenges associated with assessing developmental strengths, especially in children who might have severe developmental impacts in a motor domain or in domains that might make clinicians have assumptions about what they can do. We also had discussions about how existing developmental assessments might not capture the day-to-day or even hour-to-hour or minute-to-minute variability in a child's developmental strengths, and how that might underestimate a child's potential. We also discussed how when we think about a clinic visit or an assessment, that's a static single time point, and the experience is much more dynamic. And how there are a number of challenges in predicting certain types of outcomes, and epilepsy was specifically mentioned. And so the research questions that we came to after that discussion, which we tried to frame in the early makings of a comparative effectiveness research question, or what's the best way to measure cognition and the ability of a child to interact with their environment, especially when they might have severe impacts in other domains. And it's phrased a little bit differently. How do different existing strategies, for example, neuroimaging or longitudinal assessments, compare in their ability to capture cognitive ability? What assessments best capture the day-to-day variability in developmental strengths, and how do existing measures compare in their ability to do that? How do different strategies compare in their ability to predict epilepsy later in life, with a specific interest in children with mild HIE? And I'll stop there, but our group had a really important insights, especially around this idea of measurement. And so really grateful to all of them. Thank you.
Thank you so much, Monica. Well, I have one slide here that kind of reminds us again that this is the first of this type activity. After this session, we will be sending out a post-convening survey. So we want to continue hearing your feedback on, we hope that this sparks more conversations, more thoughts, and we want to continue collecting this. So this is, think of this as, the first day of building these partnerships, and it will be an open communication to continue this work. Additionally, after this, there will be a research uncertainty survey. And so we will be working together in our PCORI PAC crew to start to bring together everything that was discussed, everything that we heard about in the report out. And then additionally, there will be more opportunities for our community to chime in. So not just the individuals in this room, but we would love for you to all share it with the rest of the community so they can also submit their uncertainties. This will be open to families, clinicians, researchers to chime in on these topics. Then moving into step 3, we have the very hard job of starting to rank them. So once we collect all of these areas of uncertainty, then we'll be looking at across our comparative effectiveness research questions and across our other research priorities, what are our priorities? So this will be looking at July, August, September. There'll be a series of workshops and surveys to start gathering your input and then shaping that agenda that I talked about in the beginning. Ultimately, the final goal is to keep you all engaged. So if you're interested in any of the topics and passionate about keeping our research aligned with these priorities, we hope that you can stay involved in with our group. So, but Danielle, I would love to, so you can help summarize everything that was discussed.
I think we just want to echo that nobody wants research to be dictated by just the scientists or just the doctors, because they don't know. It's the people in this room, it's the people who are living it day to day. You have the questions. So take this and keep it in the front of your mind. And as you go through your day-to-day life every day, think, what are the questions? What are the questions that are coming to my mind? How do we get scientists to answer those questions? And then even if it's like flooding Maggie's inbox with like shooting her a quick email, this is another question I thought of, or this is a priority that we have to get to, then just keep spreading them out, because this is the stream that we need to continually have engaged. Okay, so keep your inboxes open, and you're going to be getting more surveys and requests for more involvement.
And thank you to our facilitators who led such an important discussion, and we'll stay busy and engaged in this follow-up work.
So that was a lot. Just acknowledging that everyone that is in this room stuck through a lot. Probably feels like from Erica's point early this morning. I don't know how many fire hoses, but endless, right? It is a lot. And so your attention and your engagement, we are beyond thankful for all of you that are here and doing this together, those that joined us online, and obviously a bigger community out there. So you guys are in the room, but we think of our virtual room too. And so continuing this forward, I'm just so grateful for everyone sticking in today, being talked at a lot, being talked to, and talking amongst yourselves as well and ourselves. We have a optional pizza dinner if you want at 6:30 that's coming up. People have asked about t-shirts that were handed out. We would love to have you wear those tomorrow so we can get a group picture tomorrow to close out this wonderful weekend together. Tomorrow is really more support and advocacy and family focused because we wanted to take advantage of our research and clinical partners that were here today and in this session in particular. And speaking of which, I would love, because I can't help myself, if you guys could, the clinical and research friends that are here, go to the step and repeat and get a group picture before you head out. Thanks. And we'll get a group picture of the families tomorrow. But thank you all for hanging in there, and a wonderful day. And we're all here moving forward together. Thank you.